4 hazardous morning routines frequently adopted by individuals over 70. Experiencing dizziness, tachycardia, and unusual weakness upon waking may indicate detrimental morning routines. This video will identify 4 common, yet hazardous, morning habits prevalent among individuals over 70, and provide evidence-based strategies to promote sustained vitality and energy. 1. Abruptly rising from a seated position. Abruptly rising from a recumbent position presents a significant health risk. Prolonged periods of lying down cause blood to pool in the lower extremities. Sudden changes in posture, such as sitting or standing, prevent the body from adequately adjusting blood pressure, leading to orthostatic hypotension. This can result in dizziness and lightheadedness due to insufficient cerebral blood flow, loss of balance and increased risk of falls, and even brief syncope, particularly in individuals with pre-existing hypotension or cardiovascular disease. Postural hypotension, or a sudden drop in blood pressure upon standing, is attributed to several factors. Age-related vascular changes, including reduced elasticity, impair the body's ability to rapidly adjust blood pressure. Temporary hypovolemia, resulting from slower blood circulation during sleep, can lead to insufficient cerebral perfusion upon sudden postural changes. Mild dehydration following prolonged recumbency further diminishes blood volume, contributing to blood pressure instability. Finally, age-related decline in autonomic nervous system function compromises the body's ability to effectively regulate blood pressure. The serious consequences of rising too quickly include an increased risk of falls. Falls in the elderly can result in fractures, particularly hip fractures, leading to extended hospital stays and potential loss of mobility. Head injuries pose a significant risk, with falls resulting in a heightened chance of traumatic brain injury. Furthermore, rapid changes in posture can increase cardiac strain. In individuals with cardiovascular disease, sudden drops in blood pressure necessitate increased cardiac effort to compensate, potentially triggering arrhythmias or angina. Remediation, a 3-step process for safe rising. Step 1. Pre-rising preparation. Upon awakening, take several deep breaths and gently move your fingers and toes to stimulate circulation. Rotate your ankles and wrists to improve blood flow. Step 2. Gradual rising. Turn onto your side, using your arms for support to slowly raise your upper body. Remain seated for 30 to 60 seconds to allow your body to adjust to the new posture. Step 3. Safe standing. Place both feet firmly on the floor, maintaining balance, and gently rotate your ankles and flex your knees. Once stable, slowly stand. If necessary, use a stable support such as a bedrail or chair for balance. Individuals requiring particular attention include those over 70 years of age, whose cardiovascular and autonomic nervous systems function less efficiently, individuals with a history of hypotension, who are at significantly increased risk of postural hypotension, those with cardiovascular disease, in whom rapid changes in posture may overexert the heart, and individuals with diabetes, whose blood pressure regulatory systems may be compromised by diabetic complications. 2. Refrain from immediately consuming water upon waking. Failing to drink water immediately upon waking poses several health risks. After 6 to 8 hours of sleep, the body experiences dehydration due to respiratory and cutaneous water loss. Prolonged periods without hydration lead to increased blood viscosity. Even without fluid intake, the kidneys continuously filter waste products, excreting toxins through urine, further contributing to unnoticed dehydration. This lack of immediate rehydration can cause significant health problems, particularly in individuals over 70. The consequences of neglecting morning hydration are demonstrably severe and pose significant risk to overall health, particularly for the elderly. Dehydration significantly impacts the circulatory system. A lack of sufficient water thickens the blood, forcing the heart to work harder to maintain adequate circulation. This increased strain on the cardiovascular system elevates the risk of hypertension, heart failure, and stroke in older adults, as dehydration facilitates the formation of blood clots. Furthermore, dehydration poses a substantial threat to cognitive function. Reduced blood flow to the brain, a direct consequence of insufficient hydration, leads to dizziness and impaired balance upon waking. Chronic dehydration can severely compromise cognitive abilities, increasing the risk of dementia and cognitive decline in later life. The detrimental effects extend to musculoskeletal health. Water is crucial for the production of synovial fluid, which lubricates joints. Dehydration exacerbates joint pain, stiffness, and the severity of arthritic conditions, particularly impacting the elderly population. Gastrointestinal health is also profoundly affected. Dehydration causes the large intestine to absorb excessive water from stool, resulting in hardened, difficult-to-pass bowel movements. This contributes to chronic constipation and increases the risk of developing hemorrhoids, conditions prevalent among older individuals. The cardiovascular system is particularly vulnerable to the effects of dehydration. Increased strain on the heart and blood vessels elevates the risk of stroke and myocardial infarction, especially pronounced in the morning when blood viscosity is naturally higher. The consumption of caffeinated beverages, such as coffee, without adequate water intake significantly worsens dehydration. The diuretic effect of caffeine further depletes the body's water reserves, compounding the negative consequences of morning dehydration. Therefore, prioritizing hydration upon waking is not merely advisable, it is a critical step in mitigating these substantial health risks. The avoidance of morning dehydration should be considered a fundamental aspect of preventative healthcare, especially for older adults. Remedies: the correct way to hydrate in the morning. Immediately consume 200 to 300 milliliters of water upon waking. This thins the blood, stimulates circulation, and supports metabolism, while rehydrating the body after sleep. Opt for warm water over cold water. Warm water promotes digestion, vasodilation, and cardiovascular health, unlike cold water, which can cause sudden vasoconstriction, potentially harming the digestive and cardiovascular systems. Consider adding lemon or honey. Warm lemon water stimulates digestion and aids liver detoxification, while honey soothes the throat and provides natural energy. Avoid replacing water with tea or coffee. Tea and coffee contain caffeine, which can act as a diuretic and further dehydrate the body. Coffee should only be consumed after adequate hydration. Individuals requiring special attention include elderly individuals, due to slower circulatory and digestive systems, those with cardiovascular disease or hypertension, as hydration thins the blood, reducing the risk of stroke and myocardial infarction, individuals experiencing constipation or poor digestion, as water stimulates bowel motility and mitigates constipation, and those with arthritic pain or inflammation, as hydration lubricates joints and reduces morning stiffness. 3. Consuming coffee on an empty stomach. Consuming coffee on an empty stomach is detrimental to health. The common practice of drinking coffee immediately upon waking, before consuming any food, can severely impact the digestive and nervous systems, and overall well-being. Coffee contains caffeine, a stimulant that increases gastric acid secretion. An empty stomach lacks the food necessary to buffer this acid, resulting in irritation of the gastric lining, potentially leading to inflammation, ulcers, and discomfort. Furthermore, consuming coffee while fasting elevates cortisol, negatively impacting mood and the nervous system. Consuming coffee on an empty stomach carries significant health risks. It can exacerbate gastritis and acid reflux, as the stomach's increased acid production, unbuffered by food, damages the mucosal lining, leading to pain, inflammation, heartburn, and acid reflux. Furthermore, coffee's caffeine content stimulates the adrenal glands to release cortisol, the stress hormone. This surge can induce anxiety, irritability, and, chronically, hormonal imbalances and impaired stress management. Ingesting coffee on an empty stomach accelerates caffeine absorption, potentially causing a rapid increase in heart rate and blood pressure. This poses a considerable risk to individuals with pre-existing cardiovascular conditions, potentially triggering arrhythmias or angina. Finally, coffee's stimulation of the central nervous system, while providing short-term alertness, can disrupt sleep patterns if consumed improperly. Morning consumption on an empty stomach may lead to an adrenaline surge followed by a rapid energy crash, impacting concentration and memory. Moreover, it can cause a sudden drop in blood glucose levels, particularly problematic for diabetics, potentially resulting in fatigue, dizziness, and tremors. To mitigate the adverse effects of coffee consumption, adhere to these guidelines. Always preempt coffee intake with a light snack containing protein or carbohydrates, such as bread, eggs, or oatmeal, to buffer the caffeine's impact on the stomach. Alternatively, consume water or warm water before coffee to minimize gastric irritation. Refrain from immediate coffee consumption upon waking. Wait at least 30 to 60 minutes to avoid excessive cortisol elevation. The body naturally produces high cortisol levels in the morning. Immediate coffee intake can lead to hormonal overload. Opt for low-acidity coffee or dilute it with milk. Black coffee's high acidity can irritate the stomach. Consider alternatives such as lattes, cappuccinos, cold brew, or diluted coffee to reduce caffeine concentration. Avoid coffee consumption during periods of stress or anxiety. This can exacerbate nervousness and anxiety, particularly on an empty stomach. Postpone coffee until after breakfast or when feeling more relaxed. Limit added sugar and avoid excessively strong coffee. High sugar intake leads to rapid blood glucose spikes and subsequent fatigue. Substitute honey or unsweetened milk for white sugar if desired. Individuals requiring special attention include those with peptic ulcers or acid reflux, cardiovascular disease or hypertension, anxiety, stress, or insomnia, unstable blood glucose levels or diabetes, and pregnant women. 4. Do not initiate operation before commencing physical activity. Pre-exercise warm-up is mandatory for optimal performance and injury prevention. Neglecting this crucial step significantly increases the risk of injury, diminishes workout effectiveness, and negatively impacts overall health. A proper warm-up elevates body temperature, improves blood circulation, and enhances muscle flexibility. It reduces the likelihood of injury by preparing muscles and joints for strenuous activity. Furthermore, a warm-up primes your neuromuscular system, thereby maximizing workout efficiency. Finally, it fosters a positive mental state, ensuring optimal readiness for physical exertion. The consequences of failing to warm up before exercise. Neglecting a proper warm-up before physical activity significantly increases the risk of musculoskeletal injuries. Unwarmed muscles and ligaments are inflexible and prone to strains, tears, and other damage during strenuous exertion. High-impact activities such as running, weightlifting, ball sports, and jumping pose a particularly elevated risk of muscle strains, ligament tears, dislocations, and sprains. For instance, sprinting without a warm-up can lead to acute muscle cramps or strains as the unprepared leg muscles are suddenly subjected to intense forces. Furthermore, omitting a warm-up period results in accelerated muscle soreness and fatigue. The body's inability to adapt gradually to the increased workload leads to a rapid buildup of lactic acid, causing pain and exhaustion. This compromises training effectiveness, leading to premature fatigue and decreased motivation. Beginning a squat or push-up routine without a warm-up, for example, will subject muscles to sudden, intense stress, resulting in delayed onset muscle soreness. The cardiovascular system is also adversely affected by the abrupt onset of intense physical activity. The sudden surge in heart rate, without prior physiological adaptation, can cause dizziness, shortness of breath, and even increase the risk of stroke in individuals with pre-existing cardiovascular conditions. A proper warm-up facilitates gradual vasodilation, preventing the heart from being overwhelmed during exercise. Engaging in vigorous cardio, such as sprinting or jump rope, immediately upon waking without a warm-up can shock the cardiovascular system, as the heart is unprepared for the sudden demand for increased blood flow to the muscles. Finally, inadequate warm-up significantly impairs athletic performance. A lack of flexibility and muscle readiness directly translates to reduced speed, endurance, and precision of movement. Elite athletes consistently prioritize thorough warm-ups to optimize performance and minimize the risk of injury. A soccer player, for example, who fails to warm up adequately will lack the necessary flexibility and power in their leg muscles to execute powerful kicks or rapid movements effectively. In conclusion, the benefits of a comprehensive warm-up routine are undeniable and crucial for injury prevention and peak performance. Proper warm-up procedures are crucial before any exercise. The principle is to progress gradually from light to intense activity, avoiding strenuous movements initially. Allocate at least 5 to 10 minutes to allow adequate physiological adaptation. Focus your warm-up on the muscle groups to be engaged. For example, prioritize leg warm-ups before lower body exercises and arm warm-ups before upper body exercises. An effective 5 to 10 minute warm-up routine should include elevating body temperature. This can be achieved through light jumping jacks, jogging in place, brisk walking, or slow jogging, and joint rotations of the wrists, ankles, shoulders, and knees. Dynamic stretching. Prioritize dynamic stretches over static stretches. Incorporate torso twists, leg and arm swings, and stretches targeting the back and legs. Rehearsal movements. Perform light versions of the planned exercises. For example, practice a few light squats before a squat workout or high knees and jogging in place before running. A sample 5-minute warm-up routine before running could consist of light jumping jacks, ankle and knee rotations, high knees, arm and leg swings, and jogging in place. Individuals should prioritize warming up, especially those over 30, whose joints lose flexibility, increasing injury risk without proper preparation. Sedentary individuals, due to prolonged sitting and limited physical activity, require thorough warm-ups to prevent muscle soreness. Those with a history of joint or back pain must warm up adequately to mitigate injury risk. Finally, high-intensity athletes, including gym-goers, professional athletes, and footballers, need extensive warm-ups to optimize performance. Having identified 4 common morning errors, we are curious to know which proved most unexpected. Alternatively, perhaps you possess a personal morning routine conducive to well-being? We encourage you to share your insights in the comments section below. If you found this video informative, please indicate your approval with a thumbs up and disseminate it to those who may benefit from this information. Maintain your health and well-being. We look forward to your participation in our next video.